Bismillahirrahmanirrahim. In last video we have discussed the definition of burn as well as its types of burn, classification of burn. Now in this video we will discuss the pathophysiology of burn. What happens when a process of burn occurs? The heat causes the coagulation necrosis of skin and the subcutaneous tissue, which releases the vasoactive peptide, and these vasoactive peptide causes the capillary permeability alteration, and there will be a loss of fluid, and in case of fluid loss, patient develops severe hypovolemia. In hypovolemia, there will be a decreased cardiac output and decreased myocardial function. And then because of the decreased cardiac output, there will be the decreased renal blood flow. And in case of decreased renal blood flow, the patient can develop the oliguria, right? And there will be the alteration in the pulmonary resistance causing the pulmonary edema, and patient can develop infection. So in case of severe infection, there will be a systemic inflammatory response syndrome and multi-organ dysfunction modes develop, which is a dangerous condition. So this was the systemic pathophysiology, and this is the local pathophysiology. There are uh, uh, three zones in the wound. Number one, the zone of coagulation. This is zone of coagulation, and this is and another one is the zone of stasis and zone of hyperemia. So zone of coagulation, this is the central area of the wound, the necrotic area where the tissue will not recover, central area of the wound. And in zone of stasis, that surrounds the zone of the coagulation, the tissues can become necrotic or the recover. There is decreased tissue perfusion. Hyperemia, zone of hyperemia, the healing process begins from this viable tissues. So this is the in this picture I will explain you. This is the zone of coagulation, and the zone of stasis surrounds the zone of coagulation, and the outermost layer zone is the zone of hyperemia. Again, in this picture, this is a zone of coagulation, this is zone of stasis, and this is a zone of hyperemia. Okay. So the systemic dysfunctions can occur in case of burn. First of all, the cardiac dysfunction. The cardiac dysfunction are due to the hypovolemia, release of the cardiac depressant, hormonal changes like catecholamine, vasopressins, and angiotensins secretions. In renal changes are due to the release of the antidiuretic hormone from the posterior pituitary to causes the maximum water reabsorption, and release of the aldosterone from adrenals and to causes the maximum sodium reabsorption. तो अब क्या होगा इसके अंदर, इसमें रीनल चेंजेस में ADH रिलीज होगा, तो वो पोस्टीरियर पिट्यूटरी से एंड देन उसके बाद वाटर की रीएब्जॉर्प्शन करेगा. एक्सेस ऑफ एंटी डायूरेटिक हार्मोन इज रिलीज्ड from posterior pituitary and it causes the reabsorption of water. Release of aldosterone adrenals से release होगा and it causes the maximum sodium reabsorption. तो मतलब सोडियम एंड वाटर की कंसंट्रेशन बॉडी के अंदर इंक्रीज करेगी renal changes में. Now toxins releases from the wound and along with the sepsis causes the acute tubular necrosis. Myoglobin released from the muscles and case of electric injury or often from Easter is most injurious to the kidney. Pulmonary changes. In case of pulmonary changes, there will be the altered ventilation perfusion ratio, and pulmonary edema is due to the burn injury and fluid overload, inhalational injury, acute respiratory distress syndrome, aspiration, and septicemia. In the gastrointestinal changes, are due to the acute gastric dilatations which occurs in 2 to 4 days, paralytic ileus, curling ulcers due to the decreased mucosal defense, not due to the increased hydrochloric acid. So in case of paralytic ileus, अच्छा gastric जो अल्सर्स फॉर्मेशन होता है उसको हम कहते हैं इन केस ऑफ बर्न में अगर गैस्ट्रिक अल्सर फॉर्मेशन हो रही है तो दिस इज कॉल्ड कर्लिंग अल्सर। ये सवाल आपके पास एमसीक्यूज में भी आ सकता है। कोलेस्टेसिस एंड हेपेटिक डैमेज, acute acalculous cholecystitis, acute pancreatitis can occur. The bowel mucosal ischemia causes a poor motility, reduced food digestion and absorption with increased translocation of bacteria causing peritoneal edema, septicemia and abdominal compartment syndrome. So in metabolic changes, what happens? There will be the hypermetabolic rate, basal metabolic rate will be increased, and negative nitrogen balance, electrolyte imbalance, and deficiencies of vitamins and essential elements, metabolic acidosis due to the hypoxia and lactic acidosis. Now, sepsis in burn patient, the focus may be at burn site, at the catheter site, cannula, CVP line site, or the respiratory infection. आपके बर्न पेशेंट में इन्फेक्शन कहाँ से हो सकता है? बर्न साइट से होगा, लोकल जिसे हम कहते हैं। कैथेटर साइट पे इन्फेक्शन डेवलप हो सकता है, कैनुला पे, सीवीपी लाइन अगर हम पास कर रहे हैं उसके थ्रू भी पेशेंट को इन्फेक्शन हो सकता है, या रिस्पायरेटरी ट्रैक्ट इन्फेक्शन अगर हो तो। Low immunity and loss of protein and immunoglobulins, loss of barrier. Now, causes of sepsis, opportunistic infection is also common, associated like diseases, वो patient इनमें diabetes, HIV infection, old age, respiratory disease, worsen the sepsis and burn injury. अगर इन patients के अंदर burn injury हो और infection हो जाए तो फिर वो उसकी जो sepsis है पेशेंट सेप्टिसीमिया डेवलप कर जाता है। It may be a local infection or commonly by the Staphylococcus aureus, Pseudomonas, Candida aspergillosis, and herpes simplex, viral in a partial thickness, nasolabial burn, systemic infection like pneumonia, bacteremia, septicemia can occur. Burn itself creates an immunosuppression, cell-mediated immunity. The sepsis is identified by, अगर किसी को पेशेंट को sepsis हो गया जी, अब उसमें क्या होगा? उसको पेशेंट को टेम्परेचर भी होगा, पेशेंट को लेथार्जी भी फील होगी, ल्यूकोज अगर हम उसका ब्लड टेस्ट कराएंगे तो ल्यूकोसाइटोसिस भी होगा, थ्रोम्बोसाइटोपिनिया भी होगा. These are the changes which can occur. Now, infections again, infections are due to, this is very important slide. You should remember what kind of bacteria which can cause the septicemia or the wound infection in case of burn. So the staphylococci, pseudomonas, streptococci, and other gram-negative organisms, and Candida albicans. So this picture again shows the systemic changes that occur after the burn injury. Again, on what systems are involved: respiratory system, cardiovascular system, metabolic changes, peripheral and splanchnic system, immunological system, and as well as kidneys, as we have discussed. So again, the effects of burn injury. So after the burn injury, what will be the effects of this burn injury? Like shock due to the hypovolemia, renal failure, pulmonary edema, respiratory infection, adult respiratory distress syndrome, respiratory failure, and infection by the Staphylococcus aureus, beta hemolytic streptococcus, pseudomonas, klebsiella leads to the bacteremia, septicemia, while fungal and the viral infection of the dangerous types can occur. On the gastrointestinal tract, hypovolemia, ischemia of the mucosa, and erosive gastritis. Again, this erosive gastritis leads to the curling ulcer. This is seen in the patient having a burn more than 35%. The fluid and electrolyte imbalance, post-burn immunosuppression predisposes to the severe opportunistic infection, issue formation, and its problem like if defective circulation, ischemia when it is circumferential. Electrical injuries often causes the fracture. Major internal organ injuries, convulsions, development of contracture is a late problem and it leads to ectropion and microstomia, disability of different joints, defective hand function, growth retardation causing the shortening. So inhalational burn causes the pulmonary edema, respiratory arrest, acute respiratory distress syndrome. Chemical injury causes the severe gastrointestinal disturbances like erosions, perforation, stricture of esophagus, alkalis. Due to the alkalis and pyloric stenosis, this is due to the acids and mediastinal injuries. So other problems commonly seen are deep vein thrombosis, pulmonary embolism, urinary tract infection, bed sores, severe malnutrition with catabolic status, and respiratory infection. A complication of the burn contracture itself, like a hypertrophic scar and keloid formation. Toxic shock syndrome, it is a life-threatening exotoxin-mediated disease caused by the Staphylococcus aureus, and it is commonly seen in children, presents with rashes, myalgia, diarrhea, vomiting, and multi-organ failure with high mortality. This is the flow chart. You can see this flow chart again, and what are the causes of death in burn? This is the main question. What are the causes of death in case of burn? The causes are hypovolemia, renal failure, pulmonary edema and acute respiratory distress syndrome, septicemia, multi-organ failure, and acute airway block in head and neck burn. So this was all about the uh, pathophysiology of burn, and inshallah in next video we will discuss the management of burn.